All right, it is 2:34. I am going to get this party started. My name is Nancy Bailey, and I never know where to look in these things, so I'm just going to be looking around. My name is Nancy Bailey, and I'm the coordinator here at Reynolds for the Office of Student Accessibility. We have a name change, and along with some other changes that are happening, and I can only speak for the Student Affairs Division, there'll be a rollout with marketing and so forth. But yes, we are now known as the Office of Student Accessibility. And okay, help me here to advance the slide.
Should be able to click in the screen.
Okay, see, you can tell I do not teach. Here we go. All right. I thought I had a slide in here that gave my name and my lovely co-presenter, but this is Kelly McGee. She is the program supervisor for the Courage to Succeed program at UMFS. I'm going to let her tell a little bit about that. Kelly, just, again, kind of give a background about you, and then I'll just give you an overview of what we're covering today, and then we'll begin our presentation.
Thank you. So yes, I am the program supervisor for the Courage to Succeed program at the nonprofit UMFS. We support students here at Reynolds and a couple at Brightpoint and one at VCU that are neurodivergent students. We provide academic and social supports for those students so that they are transitioning from high school and beyond. So we kind of serve as a liaison, quote unquote, between the student and the college to make sure that they're able to navigate the college life a little bit easier and make it a better transition for them. I've been with the Courage to Succeed program for 12 years. My home base is Reynolds, so I love you all and this campus especially. We do have a couple on the downtown, but this is kind of our home base for majority of our students.
All right. Can you all see on your screen, because I'm thinking, are you seeing the PowerPoint? On the screen.
Yep.
Okay. Thumbs up. All right. So today we're going to talk about what is neurodiversity. It's a catch-all phrase, and she's going to go into that. What is neurodiversity? I'm going to talk a little bit to you about universal design and how that can help support all students, but in particular, we're going to also then focus in on strategies for supporting neurodiverse students. And then finally, we will talk a little bit about how can you connect students to the Office of Student Accommodations, either students that already have accommodations and you're seeing particular, observing certain things within the classroom that you want to reconnect them to us, or what about those students that you suspect may have a disability, no matter what it is, but again, we're talking about neurodiversity. Then finally, we're going to do some scenarios and hopefully you can apply a little bit of your learning here today, past experience, critical thinking, and respond to those scenarios. So that is our plan for the day.
All right. So neurodiversity. This is a catch-all term to identify a population or individual who displays atypical behavior and thought patterns as a result of a diagnosis. So in comparison to neurotypical, which is the term aligns with society norms and comes from a medical model, which views neurodiversity through the lens of diagnosis and treatment. So some common diagnoses for neurodiverse: autism, ADHD, dyslexia, dyspraxia, ID, so intellectual disabilities, OCD, and Tourette. It's estimated that 15 to 20% of the world's population is neurodivergent. And now we're going to watch the video, finally.
Yes, we have this wonderful video.
Yeah, this wonderful video. I love this this woman's channel. We actually use her a lot of times when we're working with our students to kind of explain some of their neurodiverse, I guess, models that we use to help them navigate the world. And she's really great. So I hope you enjoy.
This episode about neurodiversity is sponsored by Wondrium. Stick around till the end of the video to learn more about it. Hello, brains! I talk about neurodiversity a lot on this channel, in panels, at talks, but what exactly does neurodiversity mean? Neurodiversity, noun, is the concept that there is natural variation in the human brain that leads to differences in how we think and behave. It's short for neurological diversity. Neurodiversity. The term was first coined in the 1990s by a sociologist named Judy Singer, who argues that neurological differences, like autism, are just that, neurological differences. In other words, different brains work differently. Neurodiversity exists, just like diversity exists in ethnicity, gender, and sexual orientation. Those of us with ADHD, dyslexia, dyscalculia, dysgraphia, Tourette's, those who are neurotypical, and those who are autistic all have brains that are hardwired to work and learn differently. And even brains within each group are wired differently and have a spectrum of abilities. And while we can sometimes learn to mask those differences are still going to exist. And trying to pretend they don't, or being told that they shouldn't, often comes at a high cost to our sense of self and our mental and physical well-being, often putting our brain's operating system at higher risk for the mental health equivalent of malware, such as anxiety or depression, which is why the neurodiversity movement exists. The neurodiversity movement is a social movement historically led by autistic self-advocates and other neurodivergent activists, advocating for the acceptance of the autism spectrum as reflecting natural variations in the human brain rather than a disease that needs to be cured. This movement has grown within the autism community as well as to other neurodivergent folks. Hi. I have ADHD. While neurodiversity advocates might disagree on some things, and I obviously can't speak for everyone, there are a few key assumptions within the neurodiversity paradigm. 1. Neurodiversity exists. Different brains work differently and have distinct strengths and weaknesses. 2. Neurodiversity is valuable. Differences in how our brains work allow us to come at things from different perspectives, have vastly different skill sets, and accomplish more than we could if everyone's brain worked the same way. 3. The potentially disabling challenges that those of us who are neurodivergent face aren't necessarily inherent to our brain's differences, but often a result of the social and physical environments neurominorities exist within, which is highlighted perfectly in a blog post about the concerning condition called neurotypicality, written from an autistic perspective. The blog, which is satire, presents a world in which neurotypical brains are the neurominorities and discusses how odd those brains would seem and the challenges they would face in an autistic world. A personal example, I am very nearsighted. If I didn't live in a society that provided glasses and contacts, I would be disabled. The neurodiversity movement is a bit controversial in that it upends some of how we've thought about these things for a really long time. But most of the criticisms of the neurodiversity movement seem to come from misunderstandings of what it actually is. A lot of critics of the neurodiversity movement argue that viewing autism as just a natural variation implies that autistic people don't need any support. But in response to this criticism, one autism researcher and advocate explains it well. Neurodiversity advocates generally consider autism to be both a natural variation and a disability. Advocates therefore concurrently campaign for acceptance and respect for autistic people as valuable members of society, and also fight for appropriate support and services to meet the needs of the autistic community. And the same is true of most ADHD advocates. We recognize that life is hard for us, and there are times where it would be easier to not have ADHD. But a lot of what we struggle with is because of environmental and social factors, and can be mitigated through creating social and physical environments that account for and accommodate neurodiversity. That doesn't mean we reject medical treatment. As a neurodiversity advocate with ADHD, I'm working toward a world that recognizes, appreciates, and accommodates neurodiversity. I also have a therapist and take meds. Acceptance of my brain's differences and support for the challenges I face are not mutually exclusive. In fact, they both work toward the same goal, a better quality of life. If you'd like to learn more about neurodiversity, I've linked to some resources in the description below. In the meantime, if you're neurodivergent, neurodiverse, a neurominority, whatever term you prefer, know that advocating for your own neurodifferences and appreciating the neurodiversity that exists in this world paves the way for others to do the same. Thank you to my brain advocates and all my Patreon brains for facilitating this incredible neurodiverse community where we can appreciate each other's challenges and strengths. Like, subscribe, click all the things, and I will see you next video. Bye, brains.
So I'm talking about some language shifts. So language shifts constantly as we progress in our community. So often when there's a language shift and the use of term is because of one of two reasons. One, we have coined a term that is more specific and direct, and with what we are trying to describe, or two, the phrase or term is outdated or harmful. Advocates in the autism community have vocalized that the terms high and low functioning are restrictive, vague, and minimizing. So we can use alternatives that can be as simple as just naming the diagnosis. For example, autism, and describe how it manifests and what supports that they need to be successful. For example, student X has autism and requires or benefits from taking their tests and quizzes in a quiet, distraction-free room. This doesn't minimize that their disability, and doesn't stop the questions immediately that people might jump to if thinking high or low functioning. Next, please. Neurodivergent individuals also often have sensory needs. So these can be like sight, sound, smell, taste, touch, balance, their awareness of body position and movement, awareness of their internal body cues and sensations. They can experience both hypersensitivity, over responsiveness, and hyposensitivity, under responsiveness to a wide range of stimuli. Most people have a combination of both. Many autistic people experience hypersensitivity to bright lights or certain light wavelengths. So like for fluorescent lights in the room, certain sounds or smells, textures, tastes can also be overwhelming. This can result in a sensory avoidance. So trying to get away from the stimuli for those people that most people can just tune out. Sensory avoidance can look like pulling away from physical touch, or covering their ears to avoid loud noises or unpredictable sounds, or avoiding certain kinds of clothing. Hyposensitivity is also common. This can look like a constant need for movement, difficulty recognizing sensations like hunger, illness, or pain, or attraction to loud noises or bright lights and vibrant colors. People with hyposensitivity may engage in sensory seeking to more sensory input from the environment. So for example, people with autism may stimulate their senses by making loud noises or rocking, or the need for movement. Some things you might see in the classroom, rocking back and forth, or the inability to sit still, maybe pacing in the room. Taking over the classroom discussions, so raising their hand a lot and wanting to answer all the questions, or maybe just kind of monopolizing the conversation and not giving anyone else a chance to talk. They may struggle with social interactions, so maybe their voice volume, or their interactions with their peers and with the instructors. The inability to meet assignment expectations to loose or abstract instructions, or if given too many choices. So maybe we say, all right, we're going to write a research paper. It can be on anything you'd like. Well, that could be really scary for someone that isn't able to. Too many choices is not necessarily a good thing. So you might want to say, all right, pick one of two topics to write on. They may take directives verbatim. I had a student here at Reynolds a few years ago that was in an English class, and as many of the students do, brought his laptop to class, and expectation, you're right, taking notes, following along in class. Well, the professor noticed that they were just playing games on their laptop. Well, the professor says, all right, well, you can either put away your laptop or you can leave. Well, my student packed up his stuff and left. So maybe stating the expectation of, we don't use the laptop for games, we need to get back to work and taking notes, rather than giving them options like that, because they might just leave your class. Processing speed might be something that they struggle with, whether it be slower or faster. So slower, it might take them a little bit longer to answer a question. The class might have moved on from the topic and they're still answering the question that you were talking about a topic ago. Faster for processing speeds, their thoughts may come out quicker than what's actually being said, or you might not have any context of what they're saying. So they are maybe having that conversation in their head and they talk mid-sentence and tell you, and you're like, oh, let's pause for a second. Can we back up a little bit? Explain to me a little bit better what you're talking about.
Can I jump in here for a second?
Please do.
So with some of these examples of, things you may observe in the classroom, the need to move in pace, or the rocking back and forth, that's why you may see an accommodation form come through that will say student may need to leave the classroom suddenly, may need to stand up in the back of the room. But that could also be for folks with, some physical back issues, whatever. But when we're talking about the neurodiverse student, that's why, there is that movement in the classroom. And again, we need to make sure that it's not going to be disruptive to you as the instructors, to other students, and again, you'd want to reach out to us if we needed to maybe tweak that particular kind of conversation. The taking over the classroom discussions. I've worked directly with some faculty where that was the case with the faculty and the student, and we set boundaries for that particular student. And then the struggles with the social interaction in terms of what that can look like. Please know that in student accommodations or student accessibility, excuse me, we're here to support you when you see those kinds of behaviors, whether it's a student that has an accommodation, or we'll talk a little bit later about what about that student that you don't have anything from us for.
Good question. I'm just a little trying to get my thoughts straight. So a neurodiverse person has a diagnosis of autism, ADHD? No.
Yes.
They do.
Mhm.
And so
Some of them do.
neurodiversity is,
Yeah.
is the atypical, I'm not really sure what, I'm trying to figure out what neurodiversity is. I'm confused. I'm just a little confused.
So it's out of the social norm of what you think of typical. So they've
Right,
been
but
diagnosed.
It doesn't, like if a student has autism
Mhm.
and they display these are signs and symptoms of autism,
Mhm.
right? So how is that different from neurodiversity? Or how does
That is,
it
it's under neurodiversity.
Yeah, it's under the
It's a
umbrella.
catch-all.
Yeah.
Mhm.
Yeah.
Yeah, so, I think you as a nursing instructor, right,
Mhm.
when, we come from a medical model thinking of the diagnoses,
Right.
a person with autism, or some folks would just say an autistic person, and that could be a whole conversation.
Right.
Someone who's diagnosed as having ADHD, OCD, those examples that Kelly gave earlier, those are all under the umbrella of neurodiversity because, there's the neurotypical person, again, that's within the norms of society.
Okay.
So, think of it as an umbrella.
So is neurodiversity an actual diagnosis now?
No, it's just the catch-all
It's the
term.
umbrella.
It's
Okay,
the
I
umbrella
gotcha. That's
over
what I
the
was trying to
specific
say.
diagnosis. Okay.
Okay, I got it.
Mhm.
Okay.
So these different diagnoses
All fall under neurodiverse.
I got
Mhm.
That sometimes require, if you were in secondary and primary education, a 504 plan.
Correct.
Or
Correct.
a-
Right.
an
okay.
accommodation so that you can function within a structured
Right.
environment to participate
To
in.
achieve success, whatever that means.
Yeah.
Good question, though.
It is a
It's
great
hard to
question.
wrap your brain
It's,
around.
yeah, because I'm a psych nurse, so I'm like thinking, okay, these are
Yes.
diagnoses.
We're giving you another
And
diagnosis.
so is it another diagnosis?
No.
Or is it- Yeah, it's just a broad term for anybody who has these types of disorders.
Yeah.
Okay.
Yes. Yep.
All right.
All right, ready to move on?
Well, the last one I would say you might see in your classroom is a difficulty with any kind of change to schedule or assignment. I also have a problem with that. So, you're going to talk about universal design on that is not only verbalizing in the classroom that we're moving the test back a week in writing, put it on Canvas, put it in an email so that they can go back and check on that too.
And you may see some kind of behavior when you make these announcements, or if you're doing something differently, where the student could actually be kind of like freaking out, like, no,
Well,
you
it's
can
kind
then,
of plan.
yeah,
If it's a
perseverating on the
patient
fact
with
that
a
it was
diagnosis,
supposed to be
or a
this
student
way.
with a diagnosis of OCD,
Yes.
it increases their
Mhm.
anxiety, which was the conversation you had that you portrayed earlier, where you would have to then.
So if a sorry. to keep
No,
going.
you're fine.
No, please do.
So if a student tells me they're neurodiverse, I can expect symptoms either from ADHD, autism, OCD, and intellectual disability.
Tourette's.
Tourette's.
Okay.
There's a
Learning
whole list.
disability. It's all over
Okay.
too.
So if I'm
Well, and then
trying to communicate with the client, but will they tell you specifically I'm autism and,
Sometimes.
They may or may not.
Yeah.
okay,
If
so,
you've seen, yeah, go ahead.
yeah. He has a special ed.
I was about to say, I
background,
taught
so-
special ed for,
So he's.
7
he's,
years.
Help me get this.
one of the things I'm hearing that we need to be clear on, the question was asked, is the person that had these diagnoses? At this point, some of them are not gonna have a diagnosis.
Correct.
And we need to be clear on that.
Correct.
So they're not gonna be
Okay,
able to.
so they may
affect
not
it.
be diagnosed yet, but they're having the atypical symptoms. so
Yes.
They may be
Right.
moving towards a diagnosis of autism. OCD.
Or maybe not.
Yes,
Maybe
or
they're just,
maybe they're happy just the way they are and they
Okay,
don't perceive
okay, this is making
themselves
more sense now.
as
Thank you for that. That makes more
needing
sense.
fixing or support.
So they don't really maybe have enough criterion to meet the diagnosis?
Or
Or
they
they
just
haven't
Or
been
they just
tested.
haven't been yet,
Mhm.
where nobody's
Mhm.
taken the
Yeah,
time.
okay,
to-
so neurodiverse may be like the beginnings of realization of something, or it just may be the way
No,
It could be anything, and sometimes,
They just know they're
It's-
unique.
you know, for individuals, and it could be any of those conditions, right? That when a student hits the college environment, and the expectations in a college environment, college classroom, then the neurodivergent behavior, if you will, is that, you know, it starts like bubbling up, whereas they've navigated life just fine until, you know, this point. And so again, you may see these behaviors, this presentation of an individual in a classroom setting, clinical setting, and it's just, you're like, whoa, you know, you have a little bit of a problem here because of how, you know, that person is moving through and maybe the impact on others in that environment.
Very few of these people are going to be able to advocate for themselves. So it's in your best interest that if you do find students that are having or exhibiting any of these behaviors, that you educate yourselves on how to identify them. If you do receive, because I get accommodation forms for some of my students
Right.
here,
Yes,
it does not include a full
doesn't
layout.
tell,
It
right,
doesn't
that's
say
the
just
nature
like
of
it says
it.
that This
Yep.
person might need more time.
Mhm.
This person may need, you know, copy of
Right.
instructions and things of that nature.
That was gonna be my next question.
Right, versus being in a public school, me being the special ed teacher providing these things, I'm only gonna give the general education teacher copies of those IEP accommodations.
Right.
But here, you know, you're dealing with somebody 18 to 21, they're still not, usually, very few are gonna be able to advocate for themselves to explain
And
what's
there could
going on.
be, there could be 40-year-olds that are not going to be able to
Absolutely.
navigate and advocate for themselves. So yes.
Being able to identify, understand those, and if you don't get the paperwork, still consider them being as undiagnosed and being able to very loosely give them certain accommodations. So you don't
Right, and that
advocate
kind of
for
ties
yourself.
into, again, universal design and what we'll also get to, which is how do you connect students to support?
That was my
Thank
next
you.
question, like
It's coming up.
services,
It's
yeah.
gonna be coming up.
All right.
Mhm.
Don't jump ahead.
Just okay.
Don't jump ahead.
Okay.
Know the
Let's see how like-
description.
let's see how like, wait a minute.
All right. So yes, we want to talk a little bit about universal design. I'm sure all of you at some point here in your teaching career have been exposed, maybe have taken SEAL courses, whatever, have heard the term universal design. And then I'll talk about universal design in the classroom. Universal design, it's a proactive approach to creating environments and experiences that are going to be accessible, usable, and flexible to the widest range of users, accessible to all. And what's beautiful about this is this minimizes the need later on for accommodations or modifications. So that's in the very broad sense of the term. And again, we can see the key features, kind of what I've said. It's proactive and it's designed to ensure inclusivity. We're focusing on accessibility, usability, and flexibility for all users. Benefits everyone, not just the individual with the disabilities, but everyone. And again, you're addressing diverse needs. Okay, so what does this look like for the learning environment? What is UDL? It's applying these same principles of universal design by creating flexible teaching methods, materials, assessments that are going to support the diverse needs of all learners. I attended a workshop way back in the day, and someone described that it's just good teaching. Okay, so again, 3 core guidelines for UDL are going to be, you're going to have multiple means of representing the material, content in various formats to ensure accessibility, and we'll talk a little bit more about that. You're allowing multiple means of expression and action, allowing students to demonstrate their knowledge in diverse ways. And then finally, multiple means of engaging those students. You're going to foster their motivation and interest by providing choices and relevance in learning. Now, of course, I understand that this is, this is ideal, right? This is nirvana. There are many courses that you teach in academic programs where you're going to have to be just a little more, within boundaries, but this, you can still work within these guidelines. Okay, so, why are we doing this in the academic environment? Again, why do we do this in college? Why would we want to do this in K-12 anywhere? Going back to, you're promoting inclusivity, okay? You're not only meeting the needs of neurodiverse students who we're talking about today, or any student with a disability, but again, all learners. As we know, we all learn different ways.
We all also know that there are folks out there that are not identified as having a disability, and they have their own challenges. As I said earlier, it's going to reduce the need for accommodations needing to be put in place for individuals. Because if your course is accessible from the start, that person who might have accommodation needs, they're going to be met, hopefully. It's encouraging engagement and participation by offering multiple ways of learning and demonstrating the students' understanding. And then finally, this aligns with Reynolds goals, institutional goals of diversity, equity, and inclusion. All right, so we've got some examples. What's this going to look like? So how can you do this? Provide notes or your lecture slides ahead of time to not only reduce anxiety for students who are going to struggle with note taking, but also it's another way of sort of truncating that learning. They can focus in and they're hopefully looking at them ahead of time and being prepared. Presenting that information in different formats, slides, a transcript that could come from a Zoom recording, you've got audio, you've got video, and you have your interactive elements. So again, just good teaching, right? In Zoom lectures, provide those recordings of your lectures. I've got some students who will have that as an accommodation, and it will state if not already being provided, but not all faculty will record, and so we encourage you to do that. Enable the captions. Make sure students know how to find those captions. Like us, right? Use your grading rubrics with really clearly defined expectations. And then finally, as Kelly mentioned, post any changes to the schedule or assignments. Post them in maybe multiple places. Again, it seems like, oh, well, I put that announcement out there, but follow up perhaps with an email as well as announcing it in class. When possible, again, we're kind of locked in here, right? With depending on what classroom you teach, what is the arrangement, what are the chairs, but when possible, if you've got the ability to offer some flexibility with seating, do so. If there's a way that a student could sit off to the side because it just seems like that's going to be the thing, to kind of work with that. I feel like Reynolds does a good job, as faculty, you do a great job with that. I hear from students over and over again for classes that are 2.5, 3 hours long. Most seem to have a little bit of a break, and that is extremely helpful. It's probably helpful for you as an instructor as well.
No, I think that those are great. Yeah, and you're talking about the pacing in the classroom and things like that. Maybe they need to sit in the back or allow them to go take breaks. I know being an adult, you can get up and go to the bathroom when you need to. Just allowing them to maybe take a little wiggle break, as one of my students calls it, go out in the hallway, come back in, is definitely helpful.
Right, and I can tell you from, my perspective from our office for students that I know in speaking with them that it seems like they are going to be that student who's going to leave the classroom a fair amount. And I've worked with a number of those students. I do coach them to sit by the door. That doesn't mean that they do. So again, if you are seeing certain things such as that, and it's just like it's in and out like 10 times during the class, please reach out to us because again, we can address it, maybe set some boundaries, maybe relocate that student. Sorry. I know, right?
Oh, it is right there. What do you know?
And again, so just different ways of demonstrating, allow the students to have those opportunities of demonstrating not only understanding of the content, but to try to engage them in the classroom. So whether it's, if you're doing a project of some kind, they have the option of doing a written presentation, an oral presentation, multimedia, but when possible, allow that. And you're offering to see some great creativity come through when that happens. Encourage collaboration. Now realize too that there are students that they hate group activities, they hate group presentations, and to maybe establish as part of how you describe that group activity, that group presentation, that different students can have different roles and what that might look like. Again, those concrete examples, rather than assuming that the group is going to figure it out and maybe do it that way, and the group is left to their own devices. And, we've all seen situations where that works well and others not so well. And then finally, you know, foster that supportive classroom culture. So students are going to feel comfortable taking risks and expressing their ideas. A couple of years ago, I had a student in, it was an English class. I can't remember if it was, I think it was a literature class. And there was a lot of discussion and there was some group activities taking place. And there was a young man who was in that class and he was just not comfortable within the group. And he would vacillate between just sort of pulling away or just and the instructor kind of recognized that early on, and as the groups were forming, it was like the first day, and she made the decision. I don't know exactly how she facilitated, but she was able to kind of like rearrange some groups to get that young man in with a couple young women students that she knew were just, that they were going to be able to kind of work with him and make him feel comfortable. Not saying that you all would do that, but that was an example of someone being intuitive and working with that student to create a better group activity. I probably don't have to tell you about scaffolded learning. You guys are the experts on that, but that is definitely very helpful, again, not only for the neurodiverse student, but it's just good teaching for all students. Okay, so, you know, kind of like, why does your universal design support neurodiverse students? It removes barriers, right? It creates options and it's empowering all students to thrive alongside of their peers. And so again, kind of reviewing a few of those examples of who is the neurodiverse student under that umbrella. Okay, so we've talked a little bit about what is neurodiversity, who are those students, what might you see in a classroom, what are some of those presentations of those individuals. But how do you get them to us, especially I think the students that you are not receiving accommodation notifications for. How do you get them to us? When to have a conversation. And some of this information on these slides are in a guide that I put together at the beginning of the semester. I've got handouts here. I will put the links in the chat. I'm thinking, where do I have those stored? But I will make sure for those of you in Zoom land that I get those links to you. But anyway, some of this information is in the guide that I have here for you today, and it lives in the hub that in Seattle's hub. I don't know, you'd have to check. I don't know exactly where, but it's out there as well. So you want to consider reaching out to students because you've got to connect with them first, right? When you see consistent difficulties meeting deadlines or completing assignments. Now that could be a lot of students, but you may have a more intuitive sense of like, because you're seeing some other things going along with that. You're seeing these students struggle with focus, participation, time management during class. Maybe they're not showing up, coming late, all of that. You're seeing a pattern of underperformance on tests or assignments. And this could be for students who seemingly are prepared. They're seemingly understanding the content. Maybe they participate well in the class discussions, but yet there's this disconnect. And then you're seeing those disruptive behaviors that we've talked about already. They're speaking out of turn, they're monopolizing the conversation on topics that have nothing to do perhaps with what you're discussing in class. And again, the pacing, the leaving the room. So, what are some best practices for conversations? And this seems like common sense, but I do get, outreach to our office sometimes from faculty. It's like, I just don't know, it's the first time, or it seems like they just don't know what to do. So that's why I wanted to include these here. Choose a private setting. Say, hey, can you come to me during my office? If it's Zoom, hey, can you hang on? I'd like to talk with you. And you want to come from, first of all, that positive, lead with a positive, focus on the things that they're doing well. It might be little things, right? But whatever it is, focus on the positive and what they're doing successfully. Try to use neutral, non-judgmental language in speaking with them, and also understand the students and respect their autonomy. Like, this is who they are, and kind of lead with all of that.
May I actually?
Yeah,
add
I
on
want to
that
jump in,
bit?
yeah, please do.
I was gonna say, a lot of our students, they are working on their self-advocacy skills. So you might have to initiate that conversation. Hey, I noticed that you've been studying really hard for this test, but your grade wasn't so great. Can you tell me what's worked for you in the past? And maybe that can kind of get the conversation going a little bit, and they'll be like, well, then, yeah, I had an IMP in high school and this worked for me. So just maybe it's that they're afraid to approach you. So if you kind of come in from a caring standpoint, caring point of view, and just start that conversation, not everybody's going to be welcoming to that, but a lot of our students, they're working on that. So just getting that ball rolling can be helpful.
Right. And when I talk with students that have sought accommodations and they're coming like within a year or two straight out of high school, and this is first time in college, I speak with them and use the example, you are now in the driver's seat. When you were in high school, if you had a 504 plan or an IEP, you were, maybe asleep in the back seat, maybe at some point you moved up to the front seat, but, mom or dad might have been driving. So now it's time for you to get in the driver's seat, and mom or dad can be in the passenger seat. I'm here in the passenger seat, but for so many of them, the advocacy skills, self-advocacy skills, they just didn't have to develop up until this point. And they could be 25, 30 and still in that same role.
Do they, so when they're in high school, obviously they have a plan in place. So
Yes.
how many students do you see that come into Reynolds that had services in high school, but then just assume they're not going to have them in college? Or does it take a while for them to understand that they can?
That they only have them in high school if they're in public school.
No,
Right.
even private schools
Some
will
of them,
support
only
some
some of
504 plans.
Only
Yeah,
some of them, because they can drop them in, because
yeah,
they can drop them in
exactly.
high school, but then they can sometimes get them back in college. But if they've gone to certain private schools, they'll drop their plans.
It can be. So to your
So, yeah,
question, Mary,
It's difficult.
we don't know who we don't know,
Yeah.
right? So there are, and this is where we also rely on faculty, and going back to, guiding students to us. You will see students in a classroom, they will tell you, and they've not, for whatever reason, still somehow have not found their way to our office, or they may decide, just want to try this without, I'm so
Yeah,
tired of
that's
it,
what I
right?
was
So they
kind
will
of
try. And so they might not have those accommodations for whatever reason up front, but we don't
Yeah.
know who's out there that need to be with us, that we don't know who we don't know.
And I also feel like that they want to shed that stigma that they
Sure.
had in high school, and then they're, like you said, let me try without. So I guess maybe that's something we need to kind of.
Right.
work towards.
Right, and in arenas where I have that opportunity to stand before parents and students during the SOAR sessions and nursing orientations and so forth, I really do talk about, like, if you had help in high school, or if you have a condition, you really need to come talk with us, request, services, and at least they're in place. Maybe you don't need them right away, but we'll talk about them.
So they do get that in the orientation.
Yes.
And I don't know if you all know that they have to reach out to the accommodation. So that is different than high school, where the IEP was there, put together by
Yeah.
the team. So it's those self-advocacy skills, or maybe they didn't have mom and dad taking them over to the OSA to put those in place. So there might be the disconnect between high school and college at this point too.
So yeah, some examples of conversation starters, as to piggyback on Kelly, you can say, I've seen, you're having some challenges with, fill in the blank, and I want to check in and see how you're doing. Are there any resources or support I can help connect you with? And they might be like, well, I don't know. And so then you can highlight, well, at Reynolds, we have many services to, support students, and you can give the, the laundry list that you think they should be aware of anyways, but specifically mention us in there. And if you think any of these might help, we can get you connected, get you to the office, same kind of thing. You're right, mentioned, talk about whatever their success is. I'm here to support you. Sometimes, we find resources like student accessibility helpful, blah, 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 blah. So it's approaching them in a, positive manner and kind of leading them to us. All right, but then what? Okay, so you mentioned it and they're like, I don't know. you can simply just, provide the contact information. And, again, I don't know if you've provided, unless you follow up with me, and that's something I did not include in there. If you do provide contact information for us, just say, hey, I referred Jane Smith, and I suggested she reach out to you, do the application, and that way, I can then, if I can look for Jane Smith's application coming in, and you can always reach out, hey, I haven't gotten anything, did she show up? And we can then, maybe work on a plan. So that's probably, for some students that works really well, and we get that, contact all the time. But if you've got a person in your office and you've got the time and they've got the time, walk them to one of our offices at the downtown campus out here, and just, have, hey, would you like me to watch over? They're really nice people, blah, blah, blah. And that happens with burnout as well. And then finally, the other way would be, we talked about providing the resource of the contact information to us, but then, you send the email to us, include the student email, because you've spoken with the student, right? Like, if it's okay with you, I'd like to connect you with OSA. I'll send an email, they'll reach out to you, and then we can follow up. Jessica Anderson in admissions is, really great when she's doing her tours and meeting with prospective students. She will always send a follow-up email, and if they've expressed interest in student accommodations, she loops us in, and it works out really well. This is where we are. Our contact information, this is all out on the web. And we're going to take like a 5-minute break. Oh, yeah, I guess we should do questions. Yes, I'm sorry.
No, I just had a quick question with the because I have sent a few students, and then I should do a better follow-up now, I realize. But I realized that they did something because I get the accommodation notification. But so now I'll know better, to ask permission. Is it okay if I email, you guys too? But the application itself, so that is online?
Yes.
To complete or?
Yes,
or
and that's a
download?
really good question. Where do you find this application? So, and I did not prepare a slide for that.
That's okay.
But if, from the Reynolds homepage, under the student services link, you will see accommodations.
Right.
And the application is on our webpage, on the student accommodations webpage. Just for your understanding, they will complete that application online. It's a separate server, secure, confidential. It doesn't go into their student information records. We have our own platform. They complete the application. We require them to submit some form of supporting documentation. And we would address those kinds of questions, and certainly we get many questions about that. And then finally, the most important part, I think, of the process is when they meet. Right now, it's just me. They will meet with me. I review everything and really talk with the student about what are the barriers that they are experiencing to determine accommodations.
So there is something that you need. So it's not a form the doctor has to fill out.
We also have a form.
Okay.
So some students have their, information in place. They've got medical records, they've got school records.
So that's enough.
Yes,
They don't
that
have
can
to
work.
resubmit.
But we do have a form if, again, and I think many health providers like the form because it's something that they can receive, they can fill out,
And
and
scan it into
Yeah.
their records that they
Yes.
completed it.
yes.
Okay, I was just curious how the whole process works. So, especially you mentioned some may not have a diagnosis of ADHD or
Right.
be able to afford, because it's very expensive.
And
I
that's a
know,
whole
diagnostic
other, correct, and
testing,
that's a
yeah.
whole other, it's a problem, it's a barrier.
Yes.
We see students coming in, they may have, as a child, and they're telling me all the things, that, they were part of special ed, they have this or that, and they don't have current documentation. And that is hard, it's expensive, and we really, we've got some resources, but it's still expensive, even with insurance, depending on what diagnosis it could be, how busy.
Is that how, so if someone is neurodiverse and they want accommodations and they have to get documentation? So how does that pan out?
Yeah.
So is that typically when they get diagnosed?
So, the question is if someone doesn't have a diagnosis, how does that work? How does it pan out for them? And it truly depends on the individual in terms of what their resources are. If it's, again, if it's a mental health diagnosis, ADHD, they're, health conditions, and they have a medical provider that we can get supporting documentation, even if it's someone who does not have ADHD. There's not one gold standard for a diagnosis of ADHD. It can be psychological testing. It could be a series of, behavioral checklists, and it's, that a medical provider would provide. And so sometimes that is the pathway in for a student. Same thing as, with mental health, the PCP can determine someone has depression or anxiety, right? And so then we have the form. For Kelly's population of, working with so many autistic students, that is a process. I don't know, what UFMS does, in terms of if someone comes to them, hey, you have this program, I don't know, but it's diagnosis for learning disabilities and any other kind of psychological cognitive type processing disorders is very expensive and it's hard.
Yeah, it seems like neurodivergent folks might have difficulty getting services just because there's no definitions. Can be an array of symptoms. So how do you
Well, it would be that's the umbrella term. So they might have a
Right.
diagnosis of
Let's say they
ADHD.
don't have a diagnosis and they're having the atypical symptoms, and then they go to try to get services.
That could be
Yeah,
intimidating.
yeah, and we try to,
Yeah,
we
so
do our
it makes
best
me
to
feel
connect them with support
Right.
services in the area, but honestly is, as big of an area that Richmond is,
Right.
there are limited social support services for all kinds of folks, right? And
Yeah.
I moved from New York State, 20 years ago, and in the
Yeah.
area where I lived, there was an agency for this, there was an agency for that, we could get folks connected, but there's just less resources here. But we do our best to try to connect them, but there are some students that were not able, they don't have the resources. Yes?
So if the student is, I'm seeing it is as consent. So let's say the student doesn't want to be, doesn't want to be identified as under the umbrella of neuro.
Right?
Yeah, and then how do we send them to you? And, because there is,
Right,
consent
so,
needed.
I think your question is, what if you're seeing, certain behaviors, presentations
And I
in
have
the
one in my
classroom,
class.
and you've kind of addressed, this is what I'm seeing, I'm wondering, are you aware there's support? And they're like, no, I'm fine, I am fine.
Exactly what. you're
Right?
saying.
Sadly, there's nothing, nothing you can do because you're seeing the struggle. The student is saying, I'm good. And another one of my catchphrases, whether it's for students who are receiving accommodations and have gone through that process or have not, students have the right to succeed and they have the right to fail. And it's hard when there could be support and help out there and they're not accepting it, but yeah.
Thank you.
In dealing with that
Question.
situation, the best thing you can do is whoever has the best rapport with their student, try to communicate the best way to deal with it. If they're not responsive to you, they may be responsive to a different professor. If they're not responsive to the professionals, at least provide them with the information. It's whomever they respect who can provide them the information that they'll receive it from. You can only hope.
Like universally announced to the class.
No.
How do you provide?
Right.
No. Whomever is in your department, whomever has the best rapport with that particular student might be the best person to advocate how to deal with their changes.
Oh, okay.
Right, because if you sit there and make the referral and they're not receptive to the department,
Mhm.
it doesn't change the fact that they're either having difficulty or failing. So when allowing them to look at their grades, hey, you have a 60. So
Yeah.
let's try these things to get your grade up. Whomever they're receiving or have the best rapport with will be the best person to advocate to that person. And that's been the biggest complaint for professional educators everywhere, because you come in there to give your information. I play doctor, I play clinician, I play therapist, but you have to.
Yeah, because I don't want them to end up,
Absolutely.
slapping their
Right.
dentists.
Right.
Right.
But you can only provide the resources, again, I'm full of phrases, but you can only lead that horse to water. But I think you brought up a good point. And I think it might be in I don't know if I copied that information onto a slide, but in the resource guide that when you have those conversations, you can, you know, if you're so inclined, and I would encourage you to be inclined, send them an email with, here are the resources, you know, for you. Whether they read it, I don't know, but you can at least feel good about you for your part, have done what you possibly can to connect them.
And then I'm just thinking as a closing of the circle would be not obviously putting too much information, but that maybe that you refer the student and navigate, because you have to document it under your faculty advising or whatever, very briefly saying that you refer them to Office of Accommodation.
Right, I think because, yeah, you have that,
You have
the
to be
care and concern,
careful.
whatever that,
Yeah.
that alert is, yes.
Like documenting you that you discussed like
Right.
the grades or what, or you know, that you're working with them, that you identify.
Yeah.
I know, that's right, we're
Yeah.
you don't want to like.
But there,
put
yeah,
too
there,
much in there.
exactly, who needs to know in the
But you
education?
just want at least to know that if something
That was
happens
offered.
later, you did offer resources.
So to get accommodations, you have to have a medical diagnosis?
You need, yes, you need to have supporting
Some kinds of
documentation.
things.
You need to have
Medical?
supporting it doesn't have to be medical, because not everyone has a medical,
Right.
you
Like a
know.
therapist who.
Right, it can be a mental health
attest
therapist,
to Symptoms.
right, and,
That's
or
medical.
we have educational
That's a
records.
diagnosis.
Those are all
I mean, they're
medical.
gonna get a
but you
diagnosis.
have- No, but you have to
But
have some
they might
sort
have
of
to-
medical documentation. That's what I'm trying to understand.
Yeah, I would call it documentation because it's not always medical. It could be an educational record that was a 504 plan, an IEP.
But that,
Yes.
those come with medical documentation.
Well,
You
but
don't
at
get
some
those
point,
without medical documentation.
at some point, but we don't have to,
That's
we,
full
not,
medical
yeah.
documentation.
Yeah, that's a whole other can of worms.
That's
We
not-
don't
that's
have.
My kids had them.
It could be like, so if
documentation.
a client, or I'm sorry, a student goes to a therapist,
Yes,
and the therapist can attest to, yes, I've witnessed these types of behaviors and they
Right.
need accommodation.
this person is, yeah, this
So
person
as
is
long as
being
they're like a-
followed for anxiety. This person is being
Like an
followed for
LCC or
depression.
something.
Right.
Yeah, they can do the PHQ, yeah.
Yeah.
Okay.
Do you have a food for thought from someone on our Zoom?
Thank you.
Thank you. So they say, food for thought, I do a quiz online day one, tell them ahead of time that if they take longer than 5 minutes, they're working too hard. This seems to distress them. Number one, what do you like me to call you? Number two, how should I get a hold of you in case of emergency? Number three, do you have any learning issues? What can I do? What can I do that helps you learn? And number four, do you have any health issues? What should I do if you have a problem during class? Thank you.
That's good. That is great. And then I would wonder too, if that person has responded to you saying, yes, I do have a health, you know, maybe they say, yes, I have a seizure disorder, or diabetes. You want to, I'm assuming, because it sounds like you're very thoughtful. I didn't see who it was, sorry. Make sure that you, hey, are you aware that we have these resources on campus, one of which is the Office of Student Accommodations. You may want to connect with them if you have not already. And that way you're open, again, sort of opening that door again, but you're not asking them necessarily to reply back to you. They might say yes, but yeah, it would be helpful for sure to get those students connected with us.
I get everything. Even found out one student has eczema.
Okay. Thank you. Oh my goodness. Any other questions from Zoom land? All right, what is our time here?
3:34.
Okay, so let's take, do you want a 5-minute break? Do you want to keep rolling? We're going to do some scenarios, like 4 scenarios. Or we can just, yeah.
Yeah, we can keep going.
Just
Okay.
keep going and finish up.
All right, we're going to keep it on rolling. All right. What's coming up next? I don't even remember. All right, the student scenarios. Okay. For those of you who are tactile, visual learners here in class, oops, I did that. Or did I not? Oh, you know what? I did not. I printed the wrong document. All right, sorry, you tactile, that's visual learners here. Here we have our scenario. And so what I thought I would do is I'm gonna, you can read the scenario. I will read it out loud. And I will give you a couple minutes to think about it and then respond. Kelly, I will ask you to monitor the chat for responses. Okay.
Absolutely. Yes,
So-
Zoom land, put your responses in the chat, please.
All
I
right,
should
so
know, because I just gave a talk on therapy.
during the first week of class, Professor Green announces a change to the syllabus, moving an assignment deadline forward by 2 days. A student, Alex, immediately raises their hand and says, "You can't do that, it's not fair." In a loud and distressed tone, Alex seems visibly upset. They're muttering to themselves about the change as the class continues. So what I want you to think about is, how would you respond to Alex in the moment to de-escalate their stress, their distress? And what steps can you take to help Alex adapt to changes in the future? So those of you in Zoom land, you can put your responses in the chat. And in a moment, giving you time to process, I'll have you here in our world. Give me some ideas.
That's the one.
Fair,
Ellen, that's not fair.
All right.
Raceway in September.
We don't want her way.
Okay, so, yeah, what are some
Read it
ways
in.
that you might respond to Alex in that moment to help de-escalate
I
their
just
stress?
restated, Alex, you seem visibly upset about this change in the due date.
Okay, so restate what,
What I see.
identifying what you're seeing in the class, in that response.
Please take
Okay, but they're still
More.
upset.
So upset.
Can we talk about what's
After
so
class.
disturbing?
After class.
In my office.
Happy to talk with you in my office about this, okay? All right, any, those are responses. We can feel
Yeah.
also free.
Mary is
to
on
throw
the
it out.
fourth floor.
Explain the advantages of the 2 days ahead, the changes, why,
Right?
to Alex.
Chocolate.
Okay, so yeah, what might you, how might you go about that differently in the future to help Alex adapt to change, or any other student to be able to adapt to that?
I mean, clearly you would have to state that, these are it's okay if I change the syllabus. I mean, this is something, what are we changing?
Yeah, you're moving up a due date.
Yeah, yeah, so
Just,
just point out that this is okay, I'm allowed to do this, and that what can I help you to, in the future, to, when these changes occur abruptly, what will work for you? Let me just ask.
Yeah, asking. It's good.
It could be that maybe he has work and won't be able to study, so we can discuss
Right.
that.
Right,
Discuss what his issues are.
exactly, and I
Tell me
think,
so now take the test.
right, I think one of the good things you said in terms of in the moment, though, is like, we will talk about this after class. That's setting the boundary. It's acknowledging, I see you're upset, but we're gonna talk about it after class. And then, again, that's one of those things where, you can talk with them about, okay, how to anticipate, how to deal with change, get them to us if need be. And then, the other thing obviously is gonna be, and this is gonna be good for all students, right? And my guess is you're gonna do this anyways, but you're gonna put that announcement maybe in Canvas, or send it, the message out to the students. And there it is.
So scenario number 2, challenges with social interaction. Oh. Okay, this responder said, I would explain the reason for the change and how I can assist with the successful completion of the assignment on time. Good. Yeah. Tell them why you did it. It's a big thing. They need to know why. And then how to ask them how to assist.
Yeah, provide a solution.
Thank you. Okay. In a group project, Taylor, a student in your sociology class, prefers to work alone rather than collaborate with her assigned group. When the group tries to include them, Taylor gives short, factual responses and avoids eye contact. The group reports that Taylor is not contributing equally and seems reluctant to engage. So to think about, how would you address the group's concern while Taylor's supporting Taylor's participation? And what adjustments or accommodations could you make to ensure Taylor feels comfortable contributing?
I would talk to the group, find out if there's some activities for Taylor to do that might not need such a group involvement. Like, can he do the research? Or
So you would help
Can he do
facilitate
the
that within the
writing,
group,
or
what could, yeah. give
Can you
them a
put the
specific
PowerPoint
assignment.
together, things that are more, does he have the PowerPoint skills? What skills does he have that he can contribute without having to be social?
Okay.
Credit for those things. As part of my group evaluation when they do their group presentations.
How would you address it with Taylor? So not just the.
Well, I would find out what his strengths were.
Okay,
Is he a
ask
PowerPointer?
them.
Is he a
Okay.
writer?
Mhm.
Is he a researcher? And then we would talk with the group to see, because I do a group presentation every year and nobody wants to present.
Of
right?
course.
I mean, there are people who want to present.
Sure.
But most people are like, I don't want to be in front of people, so, because you know how that goes. And I'm like, okay, well, there are people who do, and because they have 10 minutes to present, that's it. And so, and then they have free reign, they don't have to do a PowerPoint, because you don't care, right? So last time they did a Dateline, which was really cool.
Yeah, and again, that's offering different
Yeah.
methods of,
I'm like, you have free, you can do a PowerPoint, I mean, because people do like, it's a fairly structured thing you can do. Or do whatever you want, somebody did a skit when you.
yeah, and again, I would think that in the.
Yeah.
Give me no rules. But at first, she
Yeah.
doesn't give them any rules, and they're like.
Exactly.
Oh, that's not good.
Yeah, but to have those clearly, they
They have
have examples.
objectives, but no real
Right.
rules on how they present the information. Because they are not from my PowerPoint world, they have lots of IT skills, right?
Right. Yeah, and to give them some, even if it's what you're looking for is part of part of the group process, sometimes group assignments, there might be like, what is this group process going to be figured out? But to provide some guidelines, specific examples, because that's going to help everybody, let alone the super anxious people. All right, anybody in Zoom? I don't see anything in the chat.
And then they get to, they judge each other on their participation, and usually everybody participates. Every now and then I get an outlier, but usually everybody does something. Yeah.
Okay. Gail says, what about the group presenting their project, including PowerPoint online through a course collaboration actually takes more work expertise? I'm sorry, Gail, is this
Is it a question?
a question or a statement?
Oh, so if it's an online presentation?
It is in response to the comments about if the participants don't want to participate, how can you get them doing it in a way without them holding back or not participating because they have to be up there presenting?
Yeah, so to offer the option of sort of doing it remotely online, is that what you're saying? Present it online?
I've done it for years and it works really, really quite nicely.
Yeah.
So alternatives to doing the group presentation.
Right, and I've had, and this is sort of off the point of a group project, but I've had students in the past, again, with significant anxiety, perhaps stuttering, in either in a public speaking class or in a class where there has to be, an individual presentation, where you may see an accommodation come through that we're going to request that student be able to record it and present it that way, to be able to present to the individual instructor. One time I was part of a group of 4 individuals that a student needed to give a speech to. So there can be, again, it could come through as an accommodation. And again, it's always like thinking outside the box. Okay. This is a scenario with sensory sensitivities. During a multimedia presentation in your history class, you play a video with dramatic sound effects and flashing images. Midway through the video, Jordan, a student, abruptly puts on noise-canceling headphones and moves to a seat in the back of the room. Later, Jordan sends an email expressing frustration with the sensory overload in the class. I had a student a couple of years ago, he just exited the room. It was just too loud and he just bolted. So how would you respond to Jordan's concerns in a way that validates their experience? So he or she has sent an email expressing their frustration about this. And then what changes in your teaching practices to minimize sensory challenges for all students, what could you do?
I would apologize, and then I would send out a disclaimer before having
Well,
sensory whatever, or maybe take
I
it
would
out
like
if I
to-
didn't need it.
I would like to learn more. Tell me what it was. What can I do?
So
better?
really identify,
Well,
yeah, like,
what
tell
was
me
the
more about
trigger,
that.
or what was the issue?
Okay,
Yeah.
seek more
I
information.
listen.
You're good.
I'm teachable.
Right, and you said for future too, so
Yeah. I
if
mean,
Jordan
Right.
was triggered, there probably were other students that were triggered, maybe they didn't have the same reaction. But how can I adjust for future?
I actually have I do a communication, thing where, and it actually has the cockpit recording of a very bad crash that occurred in, off the coast of Africa. And, I didn't play it last semester because it was for time, essence of time, but I certainly won't be playing it this semester. We're playing
Right.
2 planes crashing into each other on the tarmac. The biggest disaster, for numbers, in years was in the 90s. Certainly won't be playing it this semester.
Yeah,
And I give them the option, I send them the recording, so if they want to listen to it. at
that's
home,
a
they
very
can
good
listen.
idea.
Because it
yeah.
is a communication tool with multi-layers. And we haven't heard this recording from whatever, you've heard a little bit of the tower, but you hear there's, differences in accents. And you hear the conversation going on and there's some static, and I think it's in the mid-1990s, but you can hear the conversation not being clear, and that's the whole thing is about communication. And I give it to them if they want to listen to it.
Right, I think that's a really good idea, is to send it out to that student, or to have it for all, right? What's good for one could be good for all. But yeah, and maybe, there's trigger warnings, but that would be a different kind of a trigger warning, right? Before you play something, this video is going to have some really loud, loud sound, some flashing, bright lights. If this is going to be, overstimulating to you, and you can do that ahead of time, like, so a student would know, and then you think about, okay, they come in 5 minutes, whatever. But they can be prepared for it, because sometimes being prepared, they come in with their noise canceling headphones, right?
Or they can walk out at that section.
Right, right.
Okay, so don't worry.
Right, our last scenario, an intense focus on specific interests. In biology lecture on ecosystems, Sam frequently raises their hand to share detailed information about their personal research on coral reefs. While the information is accurate, Sam's comments often derail the discussion from the intended topic. Other students seemed disengaged or frustrated by the interruptions. How could you acknowledge Sam's enthusiasm while maintaining the flow of the classroom? And what strategies might you use to balance class participation and keep discussions on track?
I had a student similar to this, but it was a very small classroom. And I positioned myself right next to him. And when this would happen, I would just reach over and put my hand on top of his. And he knew that, because we had a couple talks about.
Yes,
So he would
yes.
help him recognize that, oh, I'm doing it again.
Yeah, I had a student last semester where, again, one of those conversations with the student and faculty member, and that's kind of what we did. They figured out the signal, and it was that
I wouldn't touch it.
come up close, just coming up, walking, and she walked around the classroom anyways, so she just put her hand on the desk in front of her.
No, I'm just saying on the desk.
On the desk, yeah, you don't have to touch the person
Right.
unless they figured out that was an okay thing. That's one of those.
She bonded with him.
Yeah.
Well, we had conversations on communication skills.
Mhm.
So I felt comfortable enough to put my hand on them to say, this is one of those moments.
They bonded.
Oh, okay.
Or
They
do you
still
need
want
to
it.
address it in the classroom discussion? Like if it's, maybe it's the first time that you're seeing it and everybody else is just sitting there like, again, do you think you would say anything in the classroom?
Who said again?
Other students in the classroom, they're just kind of rolling their eyes. Maybe some of them are leaving because they're like, why are we here?
Yeah, I mean, you could say something like, boy, you seem to be really enthusiastic about this, and I would love to have, an opportunity to talk more, but we've got, get through. How about come see me during office hours?
Yep.
And my office is now full. I'm not doing the rest of it. Because I'd love to hear this information on coral reefs, but it's more than just what we need in this classroom.
Yes, exactly.
Please write me a paper.
Send me an email.
No, I mean, you've got a lot of information, but I don't know.
Anyone online and on Zoom have any comments?
No.
Okay.
Great. Okay, so here are the resources. Okay, maybe I can copy.
Yeah, we can, copy and paste it.
Or not. Okay, there you go.
I'll do it.
All right.
You mean put it in the chat?
Yes.
Okay.
My assistant Vanna White is going to put that in the chat for you. But you can always reach out to me if for some reason you don't save this link and you would like to have these resources, please reach out to me directly. Nancy Bailey, so it would be N Bailey, but you can find me online and I will send them to you. All right, so we made it through with a few disasters to start, nothing fatal. I appreciate your patience.
Yeah. Thank you.
And yes, thank you. And please don't hesitate to reach out to either me directly or through the OSA email if you need assistance in any way, if you have questions, and definitely connecting students via email to us. You really are sort of, you're the first responders, truly. And I don't have to tell you that you are often, as faculty, the ones that will hear the stories first. So,
Thank you.
yes, you can refer students to us. Please do.
Thank you.
All right.
Thank you.
Thank you so much. Thank you online in Zoom land.
Oh,